here in Missouri, to date, H1N1 is the predominant strain.
According to the Missouri Department of Health and Senior Services, during the week ending December 28, 2013, there were more than 1,300 reported cases of the flu. Dr. Lorenzo McNelly of Capital Region Medical Center says it takes further testing to confirm the strain is H1N1. Only 7 of the cases that week were sent for viral testing. 4 tested positive for H1N1. While he didn't know exact numbers, McNelly says there have already been deaths from H1N1 in mid-Missouri this year. H1N1 is particularly alarming because this is only the second time it's been the predominant flu strain. The first time was in 2009.
When you encounter a brand new strain, there is no pre-existing degree of immunity, and as such, these strains tend to be far, far more difficult to manage.
McNelly says there's no way to know which flu strain will be dominant each year, but while other strains typically cause severe cases in the extremely young and extremely old, H1N1 can target the typically healthy young adults.
The younger population who have been vaccinated with less frequency, who have been exposed with less frequency to influenza viruses in general, also are more likely to be the severe victims when typically we see the very, very young and the very old.
H1N1 symptoms mirror those of other strains, including what first feels like an upper respiratory infection, which then rolls into a high fever, chills and shaking, and shortness of breath. The good news?
This year's influenza vaccine matched very, very well to the circulating strain.
That means if you got one, you'll likely be protected from H1N1. Juliette Dreyer, KRCG 13 News, Jefferson City.